Alrighty, good evening, everyone. I'm Dr. Randall Gates, board certified chiropractic neurologist, also chiropractic physician at Gates Brain Health. And tonight I'm talking about tips to ease your digestive system during the holidays. So it should be, maybe this will be helpful, so to speak. So we're coming into the holiday season this week. It's December 22nd tonight. And a lot of my patients are probably going to eat things that are not good for them. And we have all done it. And so whether or not you're gluten-free or dairy-free, you're on a vegan diet or low FODMAP diet, whatever it may be, most people tend to go off their diet during this week, 10-day stretch, so to speak. And then they pay for it. And then they have digestive symptoms and bloating and maybe constipation and possibly diarrhea. And what are some tips that you can do going into this? I would say the biggest thing is having a plan of action, so to speak, before you go into the holidays that you celebrate. So you want to think that you're probably going to be eating some high carb foods, probably some really dense meats as a possibility. You're going to overindulge. And so you really want to encourage motility. I will also give you the caveat right now that any recommendations I'm talking about, check with your doctor, or if I'm your doctor, check with me beforehand. But I'm not just giving carte blanche recommendations to everyone. Check with your doctor, so to speak. But these are the things I'm thinking for my patient population. So I would go into the night after your favorite holiday meals with some magnesium citrate. If you struggle with constipation, I would also be going into that evening with vitamin C. Vitamin C is known to basically act as a motility agent because so many people complain of constipation after consuming these delicious high-calorie meals. I would also be thinking about in the day following maybe a fasting protocol if it's suited to your condition and your doctor's okay with that. But I've talked a lot about intermittent fasting and other fasts for like diabetics, and again, under supervision. But fasting lots of times can be a nice way to let your digestive tract rehab, so to speak, after one of these holiday meals. I'd also be aware of bioflavonoids. So I've been talking a lot lately about eating oranges or eating broccoli. Those are two of the most dense bioflavonoid foods, and they help to prevent the absorption of endotoxin. When you eat something like a holiday dinner, you're consuming lots of carbs, lots of fat, lots of protein. And in the literature, that's literally what they feed mice in order to cause an imbalance in their gut bacteria. And when the gut bacteria get this imbalance, then they have a propensity to absorb, or pieces of them have the propensity to be absorbed, go into the liver, creates insulin resistance, creates inflammation. So eating bioflavonoid-rich foods may be of help afterwards, may be of help going into that meal, if you can think of it. Other things that I'll probably be using with my patients are compounds like berberine. Berberine typically is used in 100 milligram to 500 milligram capsules, but it can cause nausea. So again, check with your doctor on that. Lastly, you may want to think about digestive enzymes. Digestive enzymes going into those big meals can be really helpful to help you break down, the fact that you're eating maybe twice as much as you would normally eat, or maybe 3 times as much as you would normally eat. Also, things like apple cider vinegar can be really helpful. The common thing that people do is they take 1 to 3 teaspoons of apple cider vinegar, they mix it in 8 ounces of water, and then they're careful to brush their teeth afterwards because it can corrode the teeth. So those are my recommendations. Also, some people are recommending to turn off the politics. That's probably good for stress reduction, no matter which direction you lean. But yeah, having a low stress holiday weekend, I think, can be a really, really good thing. And also going into this week with a game plan, I think that's really smart, because I saw a lot of people, even though I recommended to my patients, have a gluten-free extravaganza, don't eat gluten at all costs, inevitably still like a third of them ate gluten. And so there are products out there that literally chew up gluten consumption. I use a product called Gluten Flam from Apex Energetics. That seems to be helpful for some people. But again, these are the things I'm using with my patients. Again, check with your doctor before doing any of this. And I think that's it. So any other thoughts or questions, send them to me. But again, in review, go in with a plan. You may want to have magnesium on hand. You may want to have vitamin C on hand to help your body get rid of these large meals. Think bioflavonoids the next day. Think fasting the next day if it suits your medical condition. And you may want to be thinking about digestive enzymes also going into these big meals, as well as something like apple cider vinegar to help you break down this excessive quantity of food, as well as in the days following thinking of something like berberine, which can help to kill off the excessive bad bacteria. So that's it. Tonight's a short one. I'll probably be back tomorrow night with a larger broadcast. It's Wednesday, so that's the night I do the big ones. But any other questions you have, send them to me, and have a lovely Tuesday evening, everyone. All right, bye-bye.